So good evening, ladies and gentlemen, and welcome to the 5th annual Alda Top Doctors. My name is Daniel Shitlow, and I'm honored to be your host this evening. The fact of the matter is that we were going to have another host tonight who was much better looking and charming and famous, but as we say in the old country in Spanish, a falta de pan, buenas son las tortas. In other words, if you got no bread, well, eat cake. All right. So we, 5 years ago, plus minus, Hernan Guaracao and I had a lunch at some distinguished club in Philadelphia. And I don't know where the conversation went, but we started discussing, highlighting the Hispanic community, the achievements of various segments of the Hispanic community, and somehow we ended up saying we need to do something for physicians and highlight, the presence, contributions of Hispanic physicians of Hispanic descendants in the city of Philadelphia. And then this went beyond the margins of Philadelphia to the Delaware Valley, and now we are beyond really the state of Pennsylvania. And I'm so pleased that we are celebrating today the achievements of so many wonderful people, and this 5-year journey continues, and the width and the breadth and the depth continue to grow. And I give a lot of credit to the vision of Hernan and to the skill of his incredible team. And I would like to just have you join me in a round of applause for them. So tonight we're celebrating 10 healthcare visionaries who have dedicated careers to advancing the health of the diverse communities that make up the tri-state area. Each of these physicians have their own unique personal backgrounds, backstories, and journeys that have led them to the position they are in today. They all share the distinct qualities of selflessness, dedication, compassion, empathy, resilience, and the strong desire to simply help others and keep the medical profession moving forward for generations to come. In addition to these outstanding physicians, we will be recognizing one emerging medical professional whose work is focused on developing culturally competent and language concordant care to Spanish-speaking patients, and a fourth-year medical student who represents the future of this great profession. Tonight, we will also be celebrating the lifelong contribution of one individual who has paved the way for many of us in the healthcare profession, has impacted the medical field in Philadelphia and throughout this country. And now, ladies and gentlemen, it's been a true honor to have served on this year's advisory board as vice chair under the leadership of Mr. Kevin Mahoney. Mr. Mahoney is the Chief Executive Officer of the University of Pennsylvania Health System and the Chair of the Advisory Board of Alda Top Doctors. So help me welcome Kevin Mahoney.
Daniel, thank you so much for those remarks. I especially appreciated when you pointed out that the quartet was a trio, because I was missing that fourth instrument in that. Welcome tonight. Thank you for allowing Penn Medicine to be a sponsor. It is a distinct honor for my organization to continue to support the great work to recognize the diverse culture that we're trying to build in Philadelphia and beyond. 3 words that I want to leave you with as we go through, and then a challenge. So 4 C's. The first is care, compassion, collaboration. I did notice on the board, a couple of my colleagues from a Children's Hospital here. Everyone else is from Temple, Jefferson, organizations far and wide. And that's because we can only take care of our patients if we collaborate together. And I encourage everyone to continue, when you go back to home, you go back to your home hospital, you go back to your clinics, to make sure that you challenge Dr. Meyer at Jefferson, myself, Mike Young at Temple, that we need to work together. Because apart, we're never going to be able to take care of all the patients. So collaboration. Care and compassion is what you're all about, and I salute you for that. My last challenge, I say this all the time, I thought my generation did a better job of building a more just and diverse culture. We didn't get it done. And you need to challenge us. You need to keep pushing hard. And my good friend Steve Larson, we've been together forever. That dude pushes me every day. And if he doesn't get to me by 10 o'clock, he gets to me by 11. I need you to help me create a more just culture. And we can't just go along as we have for so long. So when someone like me who doesn't have a diverse background is writing a letter, writing a pledge, sending out an email about how supportive I am, if I'm not, and that's false, you should call me out publicly and say, great speech, but that's not how your organization's running. Great speech, but you're not dedicating enough to social determinants of health. Great speech, but you're not doing enough to diversify the faculty. We were talking earlier, fantastic PhD students coming through our organizations. Despite going to all the top organizations, the only Latinx scientist they met was here in Philadelphia. So you also have the burden of being a role model to so many people. I encourage you to keep pushing, keep the fight, care, compassion, collaboration, and keep me honest, and keep the other leaders in Philadelphia and beyond honest as we go forward. I salute all the winners. I can't wait to see the smiles on your face as we give out the awards, and I'm looking forward to the Fireside Chat. And once again, thank you for giving us the honor of sponsoring this organization. Thanks very much.
Thank you, Kevin, for those wonderful statements. They're rather inspirational, and we hope that many others follow on your steps. Sorry. So throughout the event, we would like to encourage you to share, tag, and post on social media using the hashtags AldeaLive and Our Doctors. I don't know how to do it, but I'm sure many of you do. I follow what Martin Alfaro tells me to do, something I learned a long time ago, right? So thank you to our Aldea team for putting together this exceptional program, and to the advisory board, chaired by our friend Kevin Mahoney, for the commitment to this program. And they are Dr. Christian Pizarro, Dr. Iris Reyes, Dr. Johanna Vidal-Phelan, Dr. Sadia Ben-Saken, Dr. Max Mercado, and Dr. Carmen Guerra. So they have contributed to selecting today's honorees. This work, however, would not be possible if it wasn't for the support of our sponsors. Here is a word for our presenting sponsor, Penn Medicine.
There is no label for a place like this. You could call it a hospital, except it's so much more than that. This is where we will discover life-saving solutions no one else has, so that more people can live to watch their children grow and defeat diseases they've never been able to. Penn Medicine's new pavilion, on course to change the world.
Leading the way. Also, thank you to our partners at the College of Physicians of Philadelphia, and we'll hear a little more from them later. Now, I would like to introduce for our Fireside Chat, and for a variety of reasons, including fire regulations, we have no fireside, but we will have a chat. Please give a warm welcome to the founder, publisher, and CEO of Al Dia News, Hernan Guaracao, and the president and CEO of the College of Physicians of Philadelphia, Dr. Mira Irons.
Thank you, first of all of you for showing up today. I know it's not easy in these times that we're living in to come to an event like this. That's why we decided to put it also online, and people are watching out from some places in Philadelphia, the region, and probably the nation. I wanted to thank the sponsor, of course, Mr. Kevin Mahoney. You don't know how much it's significant to me when you wrote that email last year saying, what do you need? The first time a CEO from a healthcare institution of your stature asked me that question, I said, oh, maybe he want to help us. And immediately said, yes, how about if you sponsor us? And he said, yes, of course. So that made the world much easier for us in the third year of doing this event. That we started with some hesitation. He gave me the credit, but reality the credit belongs to Dr. Gisela. The one who said, this is important, and I think you should lead that. And I said, well, I could do the best I can with my people. And we decided to do that first event without knowing if we were going to find nominees to honor, because we didn't know how many Latino doctors were there. Well, in year number 5, we have over 200 nominated that we have in our registration. And every year we have new phases. We have expanded the registration of nominations to the Tri-State region and beyond, because we believe that those doctors in Maryland or New Jersey or even New York or Washington, D.C. don't get any type of attention that we're beginning to give to the medical professionals here in Philadelphia. So we're pioneering this. But talking about pioneering, we're in a pioneering organization. The College of Physicians is the second organization I would like to thank for hosting us tonight for the first time. So I feel that we're onto something, because we're surrounded by all these historic figures hanging in the wall, and I would like to see one day Latinos being hand there, hopefully, to be recognized as what they are. We have discovered many prominent physicians in the Philadelphia area, and we're proud to be tonight in your institution. There's a story to be shared, of course, about the institution, about you, about the diversity that all of us recognize needs to be achieved in medicine. And I think that all of us working together, we can make a contribution. When I look at the institution like this that have been around 230 years, I believe that there is a long way to go. So the institution, the College of Physicians of Philadelphia, is all of the country, basically. It was founded in 1787, only 10 years after the signing of the Declaration of Independence. Actually, the co-founder of this institution was somebody who signed the Declaration of Independence. So it has been more than 230 years. No doubt part of the history, the historic heritage of our city. So first question for you, Dr. Myra Irons, the new CEO of this institution, is what should we be proud about the existence of this institution in Philadelphia?
No, I think that when you look at, as Hernan said, this was founded in 1787. It's a professional society. It's not a college in the sense of, a degree conferring organization, but I like the word, it's the college in the sense of the fact that it gathers people. We have 1,500 fellows who are leaders in medicine and healthcare through the years. It serves as a gathering place. An important gathering place at the intersection of medicine, public health, and the public. When I spent the first month and a half of my, when I came here reaching out, talking to all of the former trustees, talking to leaders in public health, and everybody says that, the college serves as this important gathering place. To Mr. Mahoney's comments earlier about, having people from the different institutions in the city come together. This is a place where those conversations can happen. And so, we also have historic collections in our museum. and our historic library. And those collections have been used to tell the stories of people, to tell the stories of medicine, to inspire future leaders in healthcare, future students, but also to inspire hope. You know, it tells those human stories of the history of medicine and how it's evolved through the years. And I'm also really proud of the educational programs we have here. Those are the ones that really, I think, piqued my interest in coming here.
We'll talk about that a little bit later on, but take us to the beginning of the institution, how this came about. There was a handful of physicians that in 1787 got together and said, let's create something modeled after the College of Physicians of London. And they got together and they acted like anything else, started from little. Tell us about that beginning and tell us how that original idea is connected to the reality we're living in today.
You know, I can only imagine what that beginning was like, but I'm a Chicago native. I spent 30 years in Boston, and what I've learned about in Philadelphia is a unique city. It's a unique city of firsts. You know, how did that first medical school get created here? How did the first hospital get created here? You know, how did the first women's medical college get created here? It all starts with a group of physicians. It all starts with a group of people. You know, it all starts with a group of people coming together, having an idea, having something that they're passionate about, and then making it happen. And I imagine that that's how the college started, you know, years ago, because over 200 years ago, because there was that tradition of medicine and history and healthcare here in the city, and they wanted to preserve that. And they were prescient in terms of, you know, the determination to really preserve historical specimens, historical archives, and books for our historical library, because medicine, you know, we all in medicine learn from our history. If you just, you know, if you have a chance to go to the Mutter Museum, the Mutter Museum was prescient. You know, a year before the pandemic started, the exhibit downstairs that's titled "Spit Spreads Death," that was really focused on the influenza epidemic in Philadelphia in 1918. It opened a year before COVID hit. And having those archives and being able to tell the story of somehow what we haven't learned from history is really important.
We'll get to that episode, and I bet that you would have something to share relevant to the days we're living in today, in the middle of the 21st century pandemic.
Yeah.
Let me just take you to another step. You are the first woman ever to be appointed as CEO of the institution. So the question is, why it took 200 years to put a woman in charge?
I don't know. You'd have to ask, you know, the people that came before me. But, you know, look around the room. You know, maybe it took 200 years because, you know, over the years, medicine was historically dominated by males. And, you know, and I think this is, you know, this room is an example of that. These are former presidents, and it's the history of this institution. But, you know, I think organizations are beginning to diversify, are beginning to recognize that different people, different types of people, different genders, different races bring different things to the table. And, you know, one of our goals here is to make sure that we do exactly what you did. That, you know, in the future we will have portraits of Latinos on the wall, of more women on the wall, African Americans, more marginalized populations on the walls. But that requires, you know, people to actually think about who they're going to nominate for fellowship. You know, you become a fellow of the college through nominations. And it's important that we look at senior physicians, you know, who are currently fellows in the college, to think about those younger people that they would like to nominate for fellowship so that we can diversify the fellowship.
What is then the issue of women in leadership? What is the contribution, a unique contribution that women can make to transform, hopefully, institutions like this for the better? Not only here, but anywhere that they might get appointed. What is the unique feminine quality that makes that leader, that the female, somebody that can do something that the males couldn't do?
Wow, that's a loaded question. You know, I think women by nature tend to be collaborative. We tend to be communicators. We're used to, you know, taking care of our family and balancing careers and families, and I think we understand instinctively that it takes a village, that you do have to have a collaboration of people to make things happen. So I would hope that is something good that I can bring to the institution. We listen well. We're used to building coalitions to make things happen. Not that men don't. I don't want to get anyone upset at me out there. But I think that we bide our time a little better, I think.
I believe in that. You were in Boston doing very well after a long career in medicine. So what do you said this, I want to call it a challenge, but really it's a headache, to come to Philadelphia and take on the responsibility of leading a 200-year-old institution?
You know, so I was in Boston for 30 years, went back to Chicago for 7, and then came here from Chicago. A few things. I think it's the organization. I think this is such a unique organization. But it also, when you get to this part of your career, you know, this time of life, you start to think of legacy. You really start to think of what can I make happen? What can I help make happen? And, you know, I spent 30 years in Boston, really at children's hospitals, focused on children's health. And then I went back to Chicago for the certifying boards and at the American Medical Association to try to improve health and advocate on a national level. But the thread that really resonated in my life was education. I was a program director. Pediatricians always educate our patients. And the ability to come back, the ability to come to a place where we're educating young people in high school to try to encourage careers in healthcare and medicine. You know, physicians always like to build our bench. We love to do that. And that's a great opportunity. We have 1,500 fellows. You know, to have medical students, high school students be able to talk to them is important. But also to tell those stories, to tell the story of how history informs the present, but also looks at the future. You know, Philadelphia, it's such an interesting city because you can go back to, you know, first medical school, first hospital, but it's also for gene therapy. You know, it's also mRNA vaccines. So it's a city of innovation that never stopped. And, you know, to be able to convene those conversations here at the college is just, I couldn't have missed that. So I'm really thrilled.
The reality, however, is one might think that the College of Physicians is one of the best kept secrets in the city. Yeah. I've been living in the city for too many years. It wasn't until maybe last year when somebody came to our event and said, we'd like to host you there, that I found out it existed. So what is in your mind to increase the awareness of the existing College of Physicians in the city of Philadelphia?
Well, you're absolutely right. It is one of the best kept secrets in the city. And I think, you know, we don't communicate as well as we should. We don't open the doors to the public as well as we should. You know, the pandemic has certainly not been helpful in that regard. But I think that, you know, our hope is to be able to open the building to more public events, to have exhibits that people are going to want to see. I'd love to get more students in this building. You know, I'd love to get more medical students in this building, but also high school and college students that are interested in medicine. And I'd like for our fellows, and I know I have some fellows, we have some fellows in the audience here, to be able to be there just to talk to the students. You know, I think I had said earlier, I'm first generation, and there were no doctors in the family. And I think sometimes it's really difficult. My dad was a steel worker. You know, I didn't know how to thread, you know, to dot the I's, but I had people that were willing to take me on, that were willing to ask those questions. I think we can supply those people. And I'd like to get them excited about doing that. But, you know, you need a roadmap, and hopefully it'll happen.
I'm sure it will. People know that this place is significant, have a significant museum, the Modern Museum, and also the Historical Library that dates back to the 19th century. Tell us what treasure have been preserved there. I know the library is closed now, but I visited the museum and there are fantastic things in there. What are the ones that really impress you the most?
So, you know, I'm a pediatric geneticist, so physical, anything, you know, any physical findings impress me. But I think that, you know, if you look at the Mutter Museum, you get a sense of history. I'll just use one as an example, and this was a recent acquisition that we had. So there was a gentleman who actually needed a heart transplant, and he had acromegaly, which was a condition that causes people to overgrowth. It's one of the overgrowth syndromes. And he came to the Mutter Museum and said that that's where I want my heart to go. So he had a heart transplant, and you might have seen the article in the Inquirer. He had a heart transplant, and his surgeon said that his big question after he had the heart transplant wasn't how am I doing, but did the heart make it to the Mutter Museum? Did it make it to Philadelphia? You know, and he was impressed enough by the way the museum is respectful of artifacts and tells the story of how those artifacts are of the people that have those conditions, and also the people that have worked on those conditions, the doctors and the scientists, to want his heart to be here so that people could learn from it. Not just medical students and people that come here, but also, you know, other people that may have overgrowth syndromes, that may not know they have an overgrowth syndrome, you know. So, you know, I think that if you go through those halls, and, you know, every one of those tells a story. Whether we tell it as well as we should is something that I'm interested in, but I think providing that context for why those artifacts are there, our collection, is really important.
Connecting the long history of the institution with the present must be one of the biggest challenges, how to make it relevant. So tell us about your vision to connecting the past with the current times we're living in.
Well, I think that, you know, increasing the diversity for sure. You know, I think that, you know, as we heard earlier from Mr. Mahoney, you know, I think that our generation did not do the job that we needed to do here. And I think, you know, our students, our young people, our kids are calling the question, you know. And so connecting, you know, bringing those different voices into the fellowship, I think, is really important. I think from the museum and the library standpoint, telling those human stories, telling the human stories of conditions that couldn't be, we didn't even know what they were in the past. You know, using some of our old, you know, the old archives in the library and the old artifacts to tell those stories, but also tying it to innovation. I mean, if you took vaccines for one, you know, as an example, you know, we have you know, Civil War vaccine cards, you know, or in the collection, but telling the story of vaccine preventable disease that people have forgotten about because the vaccines work so well, and then tying that to mRNA, and then talking about the fact that, you know, mRNA can be used in cancer therapy, helps people understand that medicine is continually evolving, is continually progressing, and there's room for everybody in there.
One of the things that impressed me when I went to the museum for the first time was the history of the pandemic in the 20th century.
Absolutely.
Called influenza. Somebody called it the Spanish flu. We're trying to investigate who and why, because but it was the influenza. I think it's a more appropriate name. 100 years later, we're in the middle of a new epidemic, the 21st century epidemic, known as COVID-19. What are the lessons from this previous experience, previous epidemic, that has left us to better cope with the current circumstance?
Oh, you know, it's just eerie when you walk in there, because you watch that movie, you watch that parade, you read those panels, and you would swear that you were looking at something that happened, you know, 6 months ago. And the fact that we didn't learn, first of all, no one, we should have known it was coming, right? But the fact that we didn't learn, it was just eerily prescient that exhibit is there, and it really needs to teach us to be prepared for the next one. There is going to be a next one. We know there's going to be a next one. But I think that, if there's that saying, if you don't learn from history, it's destined, it'll repeat itself. And I think this pandemic has certainly taught us that. And the people that were most affected are the communities of color. And I think the one thing that this pandemic has blown wide open is the disparities in healthcare, and the people that are most affected by pandemics and other medical conditions.
You hope, like mine is that COVID-19 would be in the future like the flu virus or something like that.
Yeah.
That is not as harmful as it is today. We're going to eventually.
That's the hope, that this will become endemic at some point, and the healthcare system will be able to handle it.
Yeah.
I think that, and one of my roles, I was the Chief Health and Science Officer at the American Medical Association before I came here, and what I did for about a year and a half was I led the AMA effort with regards to the pandemic, and so it was all COVID all the time. And I could see the maps and I can quote the numbers, but I think that the hope is that we will have learned from this. But that's going to require a federal. This is just my opinion. There wasn't a great plan. And then there's this. I don't know that a federalist society where every state is allowed to kind of write their own solution is actually the most effective for a pandemic. But I think that we certainly have a long way to go. But a good place to start.
Let me take you to the world today. We have fortunate enough to have a good number of physicians that could be potential candidates to be fellows of the College of Medicine. So it's going to enlist them to their work with diversifying. I think the thing that we agree, everybody, tonight is that we need to diversify the world of medicine because obviously it needs to reflect the reality of the country. It's a diverse country, particularly Philadelphia. It's one of the most diverse cities in the country, segregated but diverse in every single corner of the city. So with the Hispanic physicians that are present here today, are you going to make them fellows? You're going to give them a special discount or something like that?
Well, the first step is they have to be nominated by a fellow, by two fellows. So, my message to the fellows that are currently in the audience is that, I would hope that the current fellows would actually think about nominating, looking at your list, nominating people that they know of for fellowship. There are 2 nomination periods per year, and it'll just require somebody to think about it. It's taking that step.
We agreed earlier today, before we came into this stage, that is the 2 fronts, is the people who are already in the field, who could be a good example, inspiration to the new generation, and then the beginning of the pipeline will be the kids who are in high school today that should be inspired to enter the field of medicine as something that is feasible, that is there is great opportunity and is needed in society. So let's start with the fellows. I'm sure you're going to recruit some of them tonight, probably in the coming weeks. We have a list of probably 300 of them, so we can share that list with you, and then we can make a deal for the next year event and get a cheaper rental. Anyway, but I wanted to say, what is the message for them, seriously speaking? What is the responsibility they have? They made it mostly on their own. The people, some of them came from South America, some of them struggle to make it to be medical doctors, and then the prominent people here today in the medical institution where they work. So what is the message to them, for them to act as the inspiration that the younger generations need for that front? We need to have them. What will be the message to those physicians? Hopefully we can sell them the fellowship that way?
Well, I think that if I were sitting in your position, especially the younger physicians that are here, remember to pay it forward. I think that all of us got here. We stand on the shoulders of giants, and all of us got here with help from somebody else. And, I think the one thing I have learned from physicians is that we really like to raise our bench. We really love to talk about what we do. And just sitting down and having a cup of coffee with a high school student or a college student that's interested in medicine, that means more. To you, it may be like 15 minutes, a cup of coffee, a half an hour, but that means more to that person than you would imagine. Because I was on the other side of that. Because they never think that this is possible for them. And so showing them that way is really important. Being there to answer questions is ridiculously important, because sometimes you just don't know the path. And I think that for healthcare, diversifying the workforce is really important. People instinctively trust people who understand what they're feeling and where they come from. And I think that trust is something that is really important. And I just know, and this is just as an example, so I come from a first-generation family. When someone's in the hospital, it's not just like one person in a bed. There's like 20 people that are standing there outside the door or in the room, and they expect the healthcare team to talk to them. And I've been in situations where the physician is going to talk to the patient. And they're not going to talk to it. But, the recognition that people come from communities, that people come from cultures, that people come from greater families is really important. So I would just say persevere, pay it forward, really recognize young people that you think would be good for medicine, for careers in medicine, and show them the way.
I'm sure so. You have convinced some of them already, I see, and going like this.
Yeah.
So we took care of the fellows, of the Latino physicians, yet to become fellows of the college. Let's talk about the CEOs. We're fortunate to have one of them, probably one of the most prominent one in the room. So I don't think we need to do anything with him because he's already convinced, he gets it. We need to diversify the world of medicine, and from his position he's making a contribution, and we're really grateful for that. But what you tell him, because the rest of them are not here, they're absent, that he could talk to his colleagues that they need to do in order for them to use the power they have in their office to influence these process that benefit all of us, including the institutions. If we get more diversity in the profession of medicine, the institution will be able to provide better services, make more money in the process, but also have more resources to contribute to the greater cause of keeping our community healthy. So what do you tell him in particular that he should tell the other CEOs for them to understand that this is important? This is not a Hispanic event that we do on the side. It is important for the purpose of diversifying medicine in all directions, not only Latino, but the rest of the nations that live in the city.
Well, my guess is that they recognize the importance. I think they recognize the importance, and I see, it's a big ship to turn around. These are sort of big ships to turn around, but they have to start somewhere. And I think that, I tell people, we had a conversation in the genetics workforce is there aren't a lot of us, and it really isn't diverse. And so, what my message is always look for who's not at the table. Really, look for the gaps, look for who's not at the table, and look for the voices, because you don't know what you don't know, and look for the voices that you're not hearing. And that's the first step. And then give them a leg up. It's really, it can really mean a lot.
Well, we have the fellows, now we have the CEOs. You have the media also committed to the purpose. Let's talk about the program. How can we work in that front of inspiring the younger generation? Tell us about what program you host in this college to bring high schoolers. Probably fellows will be further inspired. You tell them this is what we do here to get the younger generation planning their mind, the idea that they can be doctors themselves.
So we currently have a few programs that are really focused on on African American high school students, girls from the African diaspora, and also LGBT youth. And they actually are, they start in usually sophomore year of high school, and they go through senior year. The programs are different, but they spent one day a week here. It's been virtual for the last year, but we got them back in the building now. And the goal of it is really to encourage them to think about careers in STEM, to think about careers in healthcare. The educational staff is phenomenal, and they actually bring in fellows, from who they can identify with to talk about what they do in their careers. And they're very successful programs. But, in order to continue, I'd love to have one for Latinx youth. Would love to have one for Latinx youth. Of course, resources are important to have those programs, and space is important to have those programs. But it would be phenomenal to do that. We talk about diversifying the physician workforce, but it's always focused on the medical school. Let's, and you really have to start farther down that pipeline. You have to get kids interested when they're, I think middle school, we start here in high school, which is good. You at least start when they're young enough that you can make them think that it's possible. Because they may not have that message at home. So resources are certainly welcome, but would love to have a Latinx program here at the school.
Let me finish with this, because everybody's waiting for the substantive program, which is the recognition of the physicians. Probably this is going to be the last responsibility of your career, CEO of the institution. You eventually retire from this position. How would you like to be remembered 5, 10, 15 years from today? The person that turned that corner. But you're a female, therefore you're transformational in essence. The obvious need of diversified medicine. I bet that's something related to, I'm not trying to answer the question that I'm proposing to you, but tell us how you like to be remembered once your responsibility here is over.
I think that you always want to make an impact. Everyone wants a legacy. I'm a pediatrician, and I always think if you can make life better for children somehow, either by encouraging those young children into careers in healthcare or medicine. I graduated from med school when I'm 23. I don't think of myself as anything but a physician. I can't imagine having been anything else. I think it's a wonderful career, but creating an environment for more and more kids of diverse backgrounds to become physicians or go into healthcare is certainly an important legacy. But I also think that we have a responsibility to educate the public. The one thing we've learned a lot from this pandemic, but one of the things we really have learned is that there is this divide between medicine and public health, but then there's the public. And we have to make our case to the public. And if we could, through the college, through our exhibitions, through our programs, through our library, through our museum, through our convening, raise issues to the forefront and advocate for changes in social issues in Philadelphia, that would be it would be a great impact. I'd feel good. I'd feel like we did the right thing.
Well, lead us on that cause. They're not allowed to say we're here committed to help you from the resources that we have. We'll do this event. We'll continue to do this every year, and I'm sure that the institution is going to come up to support the work that you do here, the work that we're doing, identifying the doctors as a foundation to create inspiration for the next generation. I think it's not related to money. I didn't want to mention that. It's the inspiration. I think the shortage is inspiration.
Yep.
So thank you for the work you're doing here.
Well,
and,
thank you.
Thank you.
All right. All right. This is right.
I am not sure I need this. But I use it. Well, and thank you, Dr. Bulatovic. I wanted to say that. You know, for those of us who come from the southernmost continent, from there, another person with a Serbian name was elected President Brodić of Chile, right? Same or reasonably same origin. And many of us are first generation college. I'm a third generation immigrant, I call myself. My grandparents moved, my parents moved, and then I moved. Thank God I have American children and American grandchildren. Very proud of it. So to present our first and second award tonight, please welcome Professor, Clinical Psychiatry and Behavioral Science Medical Director, Consultation and Liaison Psychiatry at Temple Health, and immediate past president and first Hispanic woman president of the Philadelphia County Medical Society, Dr. Natalia Ortiz Torrent. Natalia.
Good evening. How are you? So the first awardee, a student leader, Juan Cerezo. I feel very identified with his story, and I specifically requested to present this award. A little bit about the background. It's my privilege to introduce you to the community of colleagues here. You remind me of when I arrived to the United States, mainland, from Puerto Rico in 2001. I come from a small town in Calle, Puerto Rico. It was very hard, challenging. Different culture, different language. Discrimination happened. I wasn't aware 100% about it. It was through social, it was social thing. Eventually I learned. Found a beacon, found some inspiration. For me, different for you. For me, it was a society of Ibero Latin American medical professionals. Then I found my sponsors, mentors, friends, families, colleagues. We stick together. We were fighting together to build bridges, to connect our people with the community in the United States, to show the talent that we have. I'm very thankful to the College of Physicians. I'm a fellow and a board member. Thank you for the opportunity to bring this. This actually was a dream of mine, to see our colleagues, our community, here in this room, celebrating each other. Eventually, my dream is to change some of the, to integrate some of the different paintings that will come along. So now it's about you. Forget about me now. So, one, so many things. I have it written, so I want to make sure I don't miss anything, Student leader. Inspiration. Many of your supervisors spoke to me so highly about you, how much you inspire your colleagues. Your fourth-year medical student going to integrate the workforce quite soon, I think, in internal medicine. Kind of a betrayal because I'm a psychiatrist, but it's okay. We need primary care physicians. Come from Colombia, Cali, Colombia. You came to the United States when you were quite young. So you're a migrant, immigrant migrant, like I was. You settled in New Jersey. You had your bachelor's degrees in microbiology at Rutgers University. And now you're attending, and I'm very proud to say, the Louis Katz Temple School of Medicine. During that time, and I have to say, stay and listen about this, how much he has accomplished. He's very humble. He has served as Temple Latino Medical Student Association, MSA, chapter president, medical Spanish course coordinator, Northeast Regional Mentorship Chair, LMSA Northeast Regional Co-Director, with goals to expand mentorship and scholarship. We're on the same page for pre-medical students. So see what can close that gap. What, 6% only of us representing. You have been having a very, a leading role in this Latino Medical Student Association National Conference, which is celebrating 50 years, which is going to be in Philadelphia in March. So this man, young man, is an inspiration. And I take my hat, I don't have a hat here, but I take my hat to you. And I want to celebrate you with all the colleagues in the community of physicians. Thank you very much for your work and your inspiration. So please, let's celebrate Juan Ceres. And before we give you the mic, we have a surprise.
Oh my God.
Yeah. We have to keep a surprise.
It's already more than I expected.
And we have a very humble. Thank you very much, Alda, for this. Official scholarship receipt.
Oh, wow. Thank you. Yeah. Wow. I did not expect that intro. Thank you so much, Dr. Ortiz. I'm not from Philly, as she said, but I feel very welcomed here in the Philadelphia community. I didn't expect to get as involved as I did, but I saw a need, especially with other Latinos that helped me get here, and that's how I became involved in LMSA as deeply as I did. I've also been involved with Puentes. I just want to help spread word to our communities, not just to patients, but as it's been mentioned before, reach out to students that come just before us, just like others did for me. And as Dr. Ortiz highlighted, we are hosting the national conference for the organization that I lead here in Philly. We're excited for, hopefully, with COVID allowing this to happen, but as we've mentioned, we want events connecting more and more medical students, undergrad, high schoolers, physicians, fellows, residents, all across the board, including researchers. I'd be honored to have any of you come join us as well. We want to bring as many people together, and it'd be great to get people here and to be a fellow of this amazing community. And we're actually having an event here for our conference, so thank you so much, Philadelphia College of Physicians. So thank you so much, Alda, and the board for this award. I'm very honored to be here. Thank you.
Thank you very much. Now it's my pleasure to introduce the emerging leader, Dr. Hema Tatwani. So for the category of emerging leader, we have an obstetrician gynecologist from Einstein Medical Center in Philadelphia, now part of Jefferson Health. She grew up in a bicultural household in Panama with parents from India and Venezuela. She moved to the United States in 2004 to complete her undergraduate studies at the University of Miami. She obtained a Master of Public Health from Emory University. They went on to medical school at the University of Michigan. She completed her residency at Temple University Hospital in 2019. Her clinical interests include the delivery of culturally competent and concordant care to Spanish-speaking patients and has been working on these efforts within Einstein. So please welcome Dr. Tatwani.
Thank you so much. This is an incredible honor. Thank you, Aldia, and all the staff and everyone that I've met have been incredibly welcoming, and thank you for that wonderful introduction as well. It's a great honor to take care of the Latin American community, and it's an integral part of who I am and what I identify with. At Einstein, we are making big efforts to try and increase our outreach to the community, and I take great honor in being part of those efforts. So thank you so much. Muchas gracias.
Muchas gracias. So now we'll continue with the ceremony. The host, Dr. Shitlow, thank you very much for the opportunity to present this.
Thank you. So the first physician nominated for top doctor is Dr. Silma Ortiz Gonzalez. Now we're top doctor scientist. Where are you? Here you are. Please come up. She's a physician scientist specializing in pediatric neurology at Children's Hospital of Philadelphia. Her clinical practice focuses on neurogenetics, taking care of children with ultra-rare neurodevelopmental and neurodegenerative disorders. Her research laboratory mechanism the role of mitochondrial dysfunction. Her laboratory uses human cellular models, including patient-derived stem cells, to study pediatric disorders with the ultimate goal of identifying potential therapeutic strategies. Please welcome Dr. Silma Ortiz Gonzalez.
Gracias. It's a great honor. Thank you, Aldia. I just want to quickly thank my community, the people that have supported me. This is a very long road, as many of you know, to be a physician scientist and finally get to have my own lab. I'm doing the work that I hope, translates into better therapies for the future for kids with very rare disorders. And I also hope to be a role model for the next generation so we can have a lot more of a diverse physicians and scientists and people in healthcare. So thank you very much.
Next top doctor is Dr. Alda Maria Gonzaga, who is a professor of medicine and pediatrics and the Associate Dean for Student Affairs at the University of Pittsburgh School of Medicine. Prior to her appointment, she served as the Internal Medicine Pediatrics Program Director for 12 years and was an advisory dean at the University of Pittsburgh School of Medicine for 5 years. She's the founder of the Progressive Evaluation and Referral Center, a clinical program to care for adolescents and adults with pediatric onset complex healthcare needs. Her educational focuses are in creating diverse and inclusive work environments and faculty development around mentorship across differences. In 2012, she was inducted into the University of Pittsburgh School of Medicine Academy of Master Educators. She has presented workshops on increasing the diversity of the physician workforce at several national meetings, including the ACGME, the Association of Pediatric Program Directors, the Medicine Pediatric Program Directors Association, and the Association Program Directors in Internal Medicine. Please join us in virtually greeting Dr. Alda Maria Gonzaga.
I'm deeply honored and humbled to win this award. There are so many people I'd like to thank for supporting me along this magnificent journey. My parents, who always encouraged me to reach higher and go further than they had. My grandmother, who was a tremendous example of love and generosity of spirit. My husband, who is my biggest cheerleader, always encouraging me to pursue new opportunities. My children, for tolerating the many work functions I've dragged them to or hosted at my home, and all the times I've worked at home while they've watched a movie on TV. I'd like to thank all of my mentors, past and current, the irreplaceable Bill Cohen, Sarah Hamill, Heidi Feldman, Maurice Clifton, Bob Arnold, Valerie Stone, Missy McNeil, my peer mentors, Issa Davis, Greg Bump, Carla Spagnoletti, Taj Mustafa, Anna Donovan, and Sarah McIntyre. They are a diverse group of people who have role modeled how to live authentically, taught me how to be a better mentor to the learners of diverse backgrounds I encounter, and how to embrace failure as a learning opportunity while continuing to press on as a physician educator. I'd like to express the tremendous privilege I have felt teaching and mentoring so many learners over the years. They have taught me as much, if not more, than I have taught them about the plurality of our world, what it means to be a good mentor and medical educator, and of course, how to more empathetically and holistically care for our patients. I'd like to thank my patients who have been the best teachers I have had. It has been a tremendous honor and privilege to have been a primary care doctor for so many patients over the last 15 years. I'm so grateful for the opportunities I've had as a result of my participation in the Clinician Educator Training Program, now called ACES, here at Pitt Med, and my many roles in academic medicine over the years. I encourage each of us, in whatever role we may have, to become involved in ensuring similar opportunities are extended to young physicians of diverse backgrounds. Let's change the face of medicine so it fully celebrates our country's rich and diverse history. Thank you very much for this award.
Our third honoree in the category of top doctor is the director of the Structural Heart Disease Program and director of the Latin American Cardiovascular Program at Einstein Healthcare Network, Dr. Christian Witzke. Dr. Witzke completed his internal medicine residency and cardiovascular medicine fellowship training at Einstein Medical Center, Philadelphia, and then completed 2 years of training in the interventional cardiology and structural heart disease at the Massachusetts General Hospital, Harvard Medical School. At Mass General, he became an expert in the performance of coronary intervention and mastered the management of extremely ill cardiac patients that required high-risk percutaneous procedures. He has a special interest in the growing field of structural heart disease. During his last year of training, he specialized in the management of valvular and structural heart disease. He's proficient in the art of percutaneous closure of heart defects, paravalvular leaks, and management of various valvular heart diseases, including aortic stenosis and mitral valve disease. He's a leading implanter of percutaneous aortic valve prosthesis, also known as TAVR or TAVR, in patients with aortic stenosis. He also helped develop the cardiogenic shock program at Einstein Health Network. He has published in numerous journals and has participated in international meetings as an expert in the field of structural and valvular heart disease. Please welcome Dr. Witzke. Congratulations. I hope not to have to use your services in the near future.
So a few words. That picture and me have nothing to do with what I do. It's 4 kids, 4 babies in the house, and a lovely wife. So this was a great honor to get this award. I think I have to be thankful for Aldia to bring this up and been doing this for the past 5 or 6 years. So I went to the first event and I was like honored just to be there. Now I'm standing up here talking about my award, so it's great. The Latino people, I love them. This is my life. I came back to Philadelphia. I trained in an Einstein Medical Center, Philadelphia, and I knew my patients from residency and then from the cardiology fellowship. Then I went to Boston, and right away I felt that I need to come back and I need to see these patients. And if you see my office, like my clinic today, I saw about 80% of the patients were Latino. So I'm really grateful to do what I do every single day because I love to see those smiles. One of the patients gave me a big kiss today. Thank God I have COVID like 4 weeks ago and I'm vaccinated. So she gave me the biggest kiss and it's just wonderful. And I hope to keep doing this for the rest of my life and not moving from Philadelphia because if I go to Miami, everybody speaks Spanish in Miami, so I'm not unique. So this is great. So thank you so much, okay? Thank you.
It gives me great pleasure to introduce the next top doctor because we go back a lot with Dr. Mario Cruz. He's regarded as one of the best pediatricians in Philadelphia. Board-certified pediatricians who joined Philadelphia Fight as the medical director for the Pediatric and Adolescent Center in 2017. He completed his undergraduate training in biology and psychology from Union College, his medical school training at Albany Medical College, his residency training at St. Christopher's Hospital for Children, and his chief residency at the Albert Einstein Medical Center. He joined Philadelphia Fight Pediatrics after 9 years as an academic pediatrician at St. Christopher's Hospital for Children, where he led the medical training program as associate residency program director. He also has experience working in private practice through Advocare. Currently, he's clinical associate professor of pediatrics at Drexel University College of Medicine, has additional training in child abuse pediatrics, and through the American Academy of Pediatrics Child Abuse Preceptorship, and has completed formal training in educational scholarship through the Academic Pediatric Association's Educational Scholar Programs. Please join me in congratulating Dr. Mario Cruz.
Boricua! No, stop. I've been waiting my whole career to say that in a medical setting, so this is it. It's now or never, right? No, thank you to Aldia. Thank you to my wife. Thank you to the nominating committee. I just want to reiterate comments earlier about paying it forward. You know, I'm a kid from the Bronx. I grew up in a drug-infested neighborhood, witnessed a ton of violence, a ton of abuse, things that kids should never see, and kids who grew up like me shouldn't be here. But I'm here because people paved the way, they opened the door, they used their connections that I could never, ever get. And so I'm appreciative to all the people that paved the way for me. And so, so thank you. And when I look around the room, I see people who have connections, networks, resources. Use those, build the next generation so that other people can do what I've been able to do. So thank you so much.
Our next awardee in the top doctor category is Dr. Gisela Muniz Pujalt. She's an assistant professor of pediatrics in the Division of General Academic Pediatrics, a graduate of the University San Martin de Porres in Lima, Peru. She completed her internship residency and chief residency at Georgetown University Hospital in Washington, D.C. She's engaged in newborn care at University of Pittsburgh Medical Center, Regional Director of Quality Newborn Care, and Medical Director of Newborn Nursery Services at McGee Women's Hospital. Through the Clinical Trials Unit at UPMC Children's Hospital of Pittsburgh, she's deeply involved in several funded research studies focused on diagnosis and management of common pediatric infections, such as otitis media, sinusitis, and urinary tract infections, as well as research related to newborn outcomes in at-risk populations. Currently, she's the chair of the Remote Village Project, an NGO that serves rural areas in Comayagua, Honduras. Her global health interests are related to indoor smoke pollution and community health care worker training. Joining us from Pittsburgh is Dr. Muniz Pujalt.
Hello, Aldea Top Doctors. Greetings from Pittsburgh. My name is Gisela Muniz, and I'm a general pediatrician at Children's Hospital of Pittsburgh. But you probably know that already. I am very excited because of the recognition and the award I have the honor to receive today. I think it's so important to highlight the hard work of providers all across the state, from pediatric general care, like in my particular situation, through adult care, subspecialty care, that focuses on underrepresented minorities, as well as the general population. It is such a great labor to do and to be part of. I am very excited and very proud that I've been recognized with this, and that I hope it serves as fuel to continue our efforts, to continue my work with newborns at high risk, especially, which is one of my passions. I hope I could be there in person, but this is how the world is running currently. But thank you so much. I am super excited, and I hope to meet you all in person maybe in the future. Thank you so much. Bye.
Our next awardee is Dr. Maria Vega Sanchez, who is an associate professor of clinical thoracic medicine and surgery at the Temple Lung Center at Temple University Hospital in Philadelphia, where she serves a diverse patient population, many of whom are Hispanic. Please come up to the stage. Along with her clinical duties, she has been heavily involved in medical education of students, residents, and fellows for an entire career. She continues to have a vested interest in expanding diversity in medical education and physicians in training, given her background and ethnicity. She's the program director for the Pulmonary and Critical Care Fellowship at Temple University, which is one of the largest fellowship programs in pulmonary and critical care medicine in the nation. The fellowship is diverse under her leadership, and she ensures that this mission carries on through every year. As an educator, she belongs to numerous professional societies, including the American Thoracic Society, where she's a member of the Education Committee, the American College of Chest Physicians, and the American Academy of Sleep Medicine. Please put your hands together for Dr. Maria Elena Vega Sanchez.
Well, thank you so much. I have my cheat sheet here because I don't want to forget anybody. But first of all, I would like to thank Mr. Guaracao, the Aldia team, and the advisory board for this award. I'm really honored. I also want to take this opportunity to thank my family, my kids, and especially my husband, who's also a physician, but he's placed my career in front of his, even if that meant that sometimes his career had to be on hold. So thank you for that. And I'm grateful to Temple University Hospital, especially to the Temple Lung Center, my chair, Dr. Kreiner, my colleagues, my mentors, who have been supporting me throughout the years and for allowing me to grow my career as a pulmonary critical care and sleep physician for almost 16 years. I want to extend my congratulations also to the other nominees and honorees tonight. This is a very important recognition for the hard work and contribution of physicians of Hispanic descent who work every day to improve the patient's health and also to improve the quality of care of the region. I'm proud to be recognized for this award because I'm a true believer that diversity leads to cultural competency, which ultimately leads to better patient care. And I hope this acknowledgement inspires other physicians in training so that they continue this job and to expand diversity and equity in training. And finally, I want to dedicate this award to my patients because this is the reason why I'm here, and thank them for putting their health and many times their lives in my hands. Thank you so much for this award.
Our next awardee is Dr. Maribel Hernandez, a cardiologist at Lankenau Heart Institute specializing in managing patients with heart rhythm disorders. She received her bachelor's degree at Yale University, her medical degree at Stanford University, did her residency in the Harvard Hospital System in Boston, and her fellowship at the Hospital of the Medical College of Pennsylvania and Lankenau Hospital. She also serves as the medical director of Lankenau Heart Institute's Women's Heart Initiative, supporting awareness, education, and prevention of heart disease in women within the community, and she's board certified by the American Board of Cardiovascular Disease and Clinical Electrophysiology. Please welcome Dr. Maribel Hernandez.
I want to thank Aldia for this great honor, and also want to congratulate all the other honorees. I'm surrounded by some very impressive colleagues and physicians. Want to thank Lankenau Medical Center and Mental Health System for a very exciting and challenging, rewarding career in clinical research, clinical practice, and teaching fellows, residents, and medical students. My specialty of cardiology, cardiac electrophysiology, is an invasive cardiology specialty, highly technical, which to these days have very, very few percentage of women. As a woman and as a Latina woman, I had to break a lot of barriers to be accepted in a male-dominated field. I'm happy to say that it has been a rewarding career, and I want to encourage women to join all areas of medicine. We belong everywhere. And I want to give I'd like to take this opportunity to thank my husband, who's right here with me, and my daughter for their strong support all these years, my family in Puerto Rico, and all the mentors and people who supported me along the way, and all the women who came ahead of me. Thank you.
So our next awardee is Dr. Diego Chavez Neko, who is Associate Professor of Pediatrics at the University of Pittsburgh Medical Center. He's also the Program Director and founder of Salud para Niños, the first pediatric bilingual clinic in southwestern Pennsylvania. A graduate of Gimnasio Moderno in Bogotá, Colombia, obtained his title as a medical doctor from Pontificia Universidad Javeriana. He completed his residency in pediatrics at Hospital Universitario San Ignacio, Clínicas Infantiles, CAFAM, and Col Subsidio. Here is a message from Dr. Diego Chavez.
Good evening. I'm Diego Chavez Neko. I'm an associate professor at the University of Pittsburgh School of Medicine, Department of Pediatrics. I'm the director and founder of the program Salud para Niños. I want to thank Alda News and the advisory board of the top doctor recognitions for this award. I'm very honored and I'm humble for receiving this recognition. It comes at the best time ever as Salud para Niños is celebrating 20 years since its creation. Salud para Niños, Health for the Children, is an acronym for Students, Residents, Faculty, and Latinos United Against Health Disparity. Over the last 20 years, we have been working closely with the community to address barriers to healthcare access and to decrease disparities in healthcare. We're very proud of the work that we do for the community, and we receive this recognition not only on our behalf, but on behalf of the community, our patients, our colleagues, and all the members of the Latino community in southwestern Pennsylvania. I personally want to thank my colleagues, my patients, my family, my wife, my son, the members of the Division of General Academic Pediatrics at the Department of Pediatrics at the School of Medicine, my department chair, and again, everybody who has made possible the success of our clinic over the last 20 years. Thank you very much. Muchas gracias.
Thank you. Our next honoree is the Associate Chair of the Department of Child and Adolescent Psychiatry and Behavioral Sciences, also a psychiatrist with the Behavioral Health Integrated Program at Children's Hospital of Philadelphia. He earned his medical degree from the University of Puerto Rico School of Medicine in San Juan and a master's degree in medical management from Carnegie Mellon University in Pittsburgh. Dr. Roberto Ortiz Aguayo completed his residency in the triple board program, Pediatrics, General Psychiatry, Children and Adolescent Psychiatry at the University of Pittsburgh Medical Center and holds board certification in all three specialties. Here is a message of Dr. Ortiz Aguayo.
Good evening. I'm sorry I cannot be there in person to receive this award. Thank you to Alda and to the selection committee, and congratulations to my fellow awardees. I am humbled to be in your company. Also wanted to extend my heartfelt thanks to my family, my colleagues, and to the children and families I have been privileged to serve. Thank you and have a good evening.
Our last honoree in the category of top doctor is Assistant Professor in the Department of Family and Community Medicine at Thomas Jefferson University. He completed his family practice residency at Chestnut Hill Hospital, followed by a fellowship in faculty development at Jefferson Medical College, both in Philadelphia. His past roles have included being Assistant Medical Director and Head of Quality Assurance for the clinical practice Jefferson Family Medicine Associate. Dr. Victor Diaz is a Leadership Fellow with the National Hispanic Medical Association and a Quality Improvement and Patient Safety Leader at Thomas Jefferson University. He was a physician leader of his department in the Southeast Pennsylvania Learning Collaborative, which developed the statewide initiatives for the improved management of chronic disease in the Commonwealth. Under his guidance, an interdisciplinary collaborative focused on the self-management support for diabetic patients, which was created and led to the successful development of a diabetes group visit program known as DISH, Diabetes and Information Support for Your Health, a first of its kind in the area. Please welcome Dr. Victor Diaz.
Good evening.
Well, this is beautiful. I think this is the prettiest thing I've ever held in my hands. Well, thank you. It's really an honor to be here. I've been paying attention to the going-ons here every year for the last 5 years. My hidden secret is that I use this as a recruitment tool. As a primary care physician that finds very little Spanish-speaking specialists in my own backyard, it's very important for me to find those surgeons and psychiatrists and OBGYNs. So Hema and the rest of you, I've got you on the list now. This is just a great opportunity for so many folks in the room, especially the young folks. I'm proud to say that my son, who's a first-year medical student at Thomas Jefferson University and is hiding behind the lights, maybe, he comes from a long line of Victors. My father, Victor Sr., we lost him a couple of years ago, but he's definitely my inspiration, and I hope I'm passing that along to future generations. My sisters are watching from the East Coast, and my family, my in-laws, my mother is also watching along with my sisters, and my in-laws are watching from the Dominican Republic. Go Dominicanos. And it's an important last 2 days in the DR because I'm second only to the fact that David Ortiz just got into the Baseball Hall of Fame. So apart from that, it's a pretty big deal in Santiago, where my family is from. So I really want to thank the city of Philadelphia. I'm from New York originally, Bronx, Queens, and Philly's a tough town, isn't it, when you're from outside? I can only imagine Pittsburgh. Hello, not too many Latinos in Pittsburgh, so my heartfelt sentiments go out to the colleagues in the other part of Pennsylvania. But you know, I love seeing patients. That's what really makes my day. The awards and the accolades and everything else pales in comparison. My colleagues are so jealous when they see my patients bringing in food as a source of gratitude. December is pasteles en hojas left and right. I have these 5 elderly women, Dominican and Puerto Rican, who I can always count on them, just delicious stuff. And also, we're the patient and doctor couple that you see with the warm hugs and the kisses before anything else goes on regarding the visit. So it's normal in our culture, but they see that as quite different and unusual. But I think they're learning from us, so that's a good thing. So I want to also, how could I not? Thank my wife, who has to put up with my early mornings and my late evenings, and has been there as a rock forever. So thank you. I feel like I had other things to say, but I can't remember. But thank you very much.
You know, there was a Philadelphia politician, councilman, Angel Ortiz, who I heard him speak once and says, when you scratch the skin of a Latina person, you find underneath either a poet or a politician. We all tend to like to say more than we say, because in prose or in verse. So this brings us to the Lifetime Achievement Award, Dr. Ana Maria Lopez. The final award of this night is very special because it celebrates the lifelong contribution of one individual who has paved the way for many of us in the healthcare profession. She serves as professor and vice chair of medical oncology and director of integrative oncology at Sidney Kimmel Medical College and chief of cancer services at the Sidney Kimmel Cancer Center, Jefferson Health, New Jersey, Thomas Jefferson University. You can keep on moseying over. It's a very long bio, so you can take your time. She joined Jefferson in 2018 from the Huntsman Cancer Institute, University of Utah, where she was professor and director of cancer health equality and inclusion, and served as the associate vice president of health equality and inclusion at the University of Utah Health Center. She graduated from Jefferson Medical College, Thomas Jefferson University, and completed her internal medicine residency and chief residency in general medicine, fellowship, hematology and oncology, cancer prevention and etiology fellowship, and MPH at the University of Arizona. She joined the faculty of the Arizona Cancer Center, where she served as founding medical director of the Arizona Telemedicine Program, professor of medicine, tenured in pathology, and associate dean for outreach and multicultural affairs. She was the site medical director of the Women's Health Initiative, the largest NIH-funded clinical trial focused on women's health outcomes, and has served as principal investigator and co-investigator for multiple cancer prevention and therapeutic trials. She's a board certified in medical oncology and integrative medicine. Her clinical expertise is in women's malignancies, integrative oncology, and telehealth. She's president emeritus of the largest medical specialty organization in the U.S., the American College of Physicians. Her strong commitment to health equity is reflected in her work with the American Society of Clinical Oncology as former chair of the Health Equity Committee and with the Association of American Medical Colleges, where she serves as member of the steering committee of the Group of Women in Medicine and Science. Her areas of expertise and research focus include cancer risk reduction, integrative oncology, and innovations in healthcare. It is my distinct honor to welcome Dr. Ana Maria Lopez to the day.
Put that down so it doesn't break. Thank you very, very much. I am so moved by this tremendous honor. Thank you to Aldia. Thank you to the committee. This is incredibly meaningful because it comes from you. It comes from my community, mi comunidad y mi gente. Muchísimas gracias. I also want to congratulate all of my fellow awardees, fellow honorees, fellow nominees. Together, we are moving the needle forward. It's great to connect with you in these incredible hallowed halls. I want to thank my colleagues who have been so supportive, who have provided such partnership and collaboration across this region, and my patients. I think that's why we get up in the morning, our patients, our students, our trainees. And of course, my family. My parents, without whom really nothing in my life would be possible. Thank you, Papi. And to my mother, who is joining in virtual land. And to my children, Elena and David, who are a constant joy. Constant source of joy and inspiration and love. So thank you so much. Thank you.
Well, every year it's getting more and more difficult for the selection committee to find to bring it down to whatever, 11, 12 people. When we started 5 years ago, 4 or 5? 4? Whatever. When we started, you know, I'm not saying the people weren't there. It's just that people weren't aware. And when Hernan and I were talking, we said, you know, we have to highlight, you know, the people who are out there that nobody knows about or very few people know about. Now, with plus 200 nominations from a tri-state area, it's becoming more and more difficult to really choose, because everybody who's been nominated has a journey to share, a relevance in society and in medicine, and you've seen it this evening. What a wonderful group of people has come forth tonight to be honored, and I would like to join me in applauding yourselves, and those who are not awardees, applauding the awardees. I would also like very, very sincerely to thank Kevin Mahoney and Penn Medicine for being our presenting sponsor. It's a very important thing to have the sponsorship of as many health systems as we can to make the leadership of health systems aware of the richness and the Hispanic medical community. And I would like to thank also to our friends at the College of Physicians of Philadelphia, and what treat has been, at least for me personally, to get to meet you, Dr. Mira. I like that. Mira, look. Anyway, for your partnership and for hosting us in this wonderful environment and wonderful place. And I, having met you recently, very recently, although we may have met before a few years ago at Elam, I have no doubt that when we come back next year, which I hope we do, somehow this room is going to look a little bit different. I have that inkling. Anyway, it's great to see that diversity has reached the College of Physicians in the form of gender equity, which is something that we are very, very passionate about, in addition to ethnic and cultural diversity coming from the medical school I come from. So with this, I would like to thank you all for your presence and wish you all the best. And it is my understanding that the Elegance Trio, the fourth person is MIA, will be playing for us and enjoy the refreshments and continue your repast. Thank you very much and good night. Up on the stage for a collective picture, please.